I'm so happy that you're here. We have a very special event today where we are highlighting and showcasing patients who have had transformational dental implant surgery. If you're here, that means that you've landed in the right place. That means that you've been thinking about this life-changing procedure, but you may still have questions. You may still want to know who's had the procedure. Were they in pain? Was it affordable? Were they scared? Those are all questions that every dental implant patient usually has. That's why we're here. That's why we have real patient stories for you to hear, and then you can make a decision if this procedure is what's right for you. You can shop around the internet all day. You can go from doctor to doctor. You can price shop. But what you want is a doctor that's going to take care of you, listen to you, show compassion to you, show you your options, and of course, give you the best result. So I am inviting you to sit back, relax, and enjoy hearing these patient stories. All right, I am so excited to have an opportunity to hear about Mr. Doug Weiner's experience with ProHealth, because he recently had some dental implants done. And how are you doing today, Doug? How you feeling?
I'm feeling great, Lauren. I'm really feeling great. And I never thought I'd be on this end of the procedure feeling as good as I do today.
Well, you look good. I can say, that smile is $1 million right there.
Well, I'll tell you that the thing is that there was a time in my life in which I was neglecting my dental hygiene, and I let things get away from me, and I started having toothaches. And the toothaches were related to decay and infection. The toothaches were becoming more frequent, and the initial diagnosis was the tooth couldn't be saved. So one by one, about 2 years ago, I had 3 decayed teeth somewhat in a row that hurt like the dickens until I was able to have them extracted.
Were you able to eat normally with the painful teeth? Like, what was your life like when your teeth were hurting like that?
Oh, yeah. No, I had a special side. I had a special technique. I had, ways of getting around things that were going to suit my mouth. But what I really wanted, and it was, Dr. K that really brought it to my attention. He indicated that, you've got abscessed teeth, you've got decayed teeth, you've got infected gums, and you've got bone recision, none of which is good in your mouth. Now, we could take somewhat of an incremental approach, but what I recommend for you is that you have all of your bad teeth out and to have implants replace them.
Now, when he told you this, Doug, what was your reaction? Like, how did you feel? Because, this is not a small procedure by any means.
Right. Well, it was kind of the worst of two evils in a way. I mean, did I want to hop, skip, and jump into the periodontal surgeon's chair and say, I have a great idea today. Let's extract my teeth. Nothing like that. But what's the alternative? And that is these nasty, sick, decayed, hurting, vulnerable kinds of teeth that aren't serving me and that I'm kind of like living in fear of. I wanted them out of my head. I didn't want to have toothaches. I didn't want to have infection so close to my brain. I didn't want to have any kinds of, continuing low-level, some low symptomatic kind of always being just a little sick, but not, not sick, but, not feeling top notch.
Dr. K, did he take good care of you? Because your smile looks great.
I'll tell you, the first thing he said to me after the extractions, and he did a great job, he's very skillful, to be really good at periodontal surgery, you need almost athletic ability with the
gotta be agile with it.
Yeah, that kind of stuff. Agile, right? First thing he said was after they were out, all of them, was that your mouth is going to feel so much better without all the
infection
stuff in it. Mm-hmm. And man, from that day, my mouth began to heal. I haven't had a toothache since that day.
Love it.
And between Dr. K and Dr. Valori, who really did a great job in fitting the prosthesis, now I'll tell you, it's more comfortable. I'm feeling more comfortable in my mouth today than I did, for 10 years before the thing.
No, people tell me all the time, it's like, they can't believe they waited as long as they did. And they're so happy that they took the plunge, took the jump, made the investment. You're an attorney, so obviously your appearance and your smile and how you communicate matters. So what would you say to anybody that's like on the fence, or they're scared, they're worried about the cost? Like, what would be your words to those people?
For me, I can honestly say that my primary motivation was not cosmetic, although that is certainly a side benefit that's very, much appreciated. For me, it was just upgrading my oral, health. Well, my wife, for example, tells me the story frequently of her dad, who, as a result of a toothache, had an infection go to his heart and suffered very serious consequences as a result. So for her and now me and, our family, it's top priority to maintain the health of, your mouth.
I don't think a lot of people know the connection between oral health and brain health and gut health and heart health. So, I think that's just awesome that you took that step, took control, you had solutions, and look at the result. You have the health, obviously, but the cosmetic side too, which is just an added benefit. So last question I have for you, Doug.
Thank you.
Anything that you want to let Dr. Neil or Dr. Bruce or Robin or any of the ProHealth Dental Implant team, anything you want them to know?
I want you to know that it's a rare service in certain respects that they're able to provide. I'm tremendously grateful that I live in a part of the world, in a time of the world in which there are people who have these skills and are able to relieve the kind of suffering and disease that have prevailed, I'm sure, for generations.
Absolutely, yeah.
And for me now, as a result of the wonderful people on this team, it's a malady that I can manage. And with that, I'm very appreciative. Thank you very much.
Well said. Well said. Thank you, Doug, for your time today. Keep smiling. And, us at ProHealth Dental Implant Center, we love these stories and we love these transformations. So we appreciate you, Doug. Have a good one.
Thank you very much. Appreciate you too. Bye now.
All right. So we just have a few minutes together, Miss Jackie, but I'm excited to chat with you today about your experience having a smile transformation with Dr. Neil Karnofsky and Dr. Bruce Valori at ProHealth Dental Implant Center. Miss Jackie, how are you feeling today?
Wonderful.
You have a beautiful smile, and you look happy, you look healthy. Tell me about what life was like before you got dental implants.
My life before came to ProHealth Dental was terrible. For over 20 years, I was in a lot of pain. I had a procedure done that went wrong, and I was in pain all the time. And I went to numerous doctors, dentists, to correct the wrongdoings of another doctor. And nobody seemed to be able to help me. And I was absolutely miserable. I could not eat. I couldn't do anything. Because I was always in pain. So my life has changed 150% since I came to ProHealth Dental. And Dr. Ronkowski and Dr. Valori are absolutely amazing. Dr. Valori worked so hard with me, and it was a long procedure, but we got through it, and I just can't say thank you enough to them. And I can't say thank you enough to my daughter, who pushed me to come to ProHealth. I said, okay, make me an appointment. And it was the best okay I ever said.
Miss Jackie, what do you think was holding you back all these years?
I could not find anybody. It would get fixed temporarily, for a short period of time. And then, it's the pain came back, and I had numerous surgery, and it was terrible. And so nobody seemed to be able to truly help me. When I came, they knew I was in pain because there was an infection and an implant in my mouth. But I never told them that I was in pain for over 20 years until I was finished with Dr. Valori. I told him it's the first time in over 20 years that I'm happy, that I'm pain-free. But on a sadder note, I just wish my husband was here to see how happy I am. Aww. So I tell everybody about ProHealth Dental. I just love them.
What do you think has been your most life-changing thing, or the favorite thing that you've been able to do since you've had this procedure?
What's the favorite thing I can do is that I can eat. I can chew. It's amazing. All of a sudden I realized, oh my goodness, I'm chewing, on a steak or, something that I could never do, and to be able to sit down at the table and eat everything that's in front of me without complaining or getting upset. So it has changed me completely.
So there's a lot of people out here that sometimes are on the fence, or they're waiting, 10, 20 plus years. What could you tell them to kind of push them over?
I would tell them about my experience at ProHealth and tell them to go speak to the doctors. And they're very caring and loving, and they're just wonderful doctors. And I am a walking example of being so happy now as opposed to being so miserable all the time.
I think your story is beautiful. Thank you so much for sharing your perspective. And, dental implants do change lives. And you are an example of, with that beautiful smile, of amazing surgical work that's done by the ProHealth Dental Implant team. So, is there anything you want to let the doctors know before I let you go?
Dr. Valori knows exactly how I feel about him, and he's just the best. He is the best of the best. Dr. Pronowski is terrific too.
Awesome. Well, thank you for your time, Miss Jackie. Keep smiling. You look beautiful. And everybody out there, if you're considering dental implants, obviously ProHealth Dental Implant Center in New York is where you need to be, right? All right. Take care.
People did say they were afraid to get implants, and I said, go to ProHealth.
Go to ProHealth. I love it. All right. Thank you, Miss Jackie. Take care.
Thank you so much.
All right. Hello, everybody. I have the pleasure of chatting with Mr. Bill Darvin, who is an amazing patient with a beautiful smile from ProHealth Dental Implant Center. Bill, how are you feeling today?
I'm doing great, thank you.
I'm glad. You look like $1,000,000. Your smile looks top notch. So
Well, since the work, I smile a lot more than I did.
it looks good on you. Keep smiling because it looks good on you. Tell me, what was your life like before you decided to get dental implants?
Well, I worried about my teeth if I traveled, you know what I mean, my mouth. I'm 78 years old, and I've always felt that if you live long enough, you'll wear out a set of teeth just by eating. And I feel that it became very trouble-free knowing that my mouth was in such good shape, and the kind of work that they had done on me was wonderful. The one who did the operating on me, Dr. Konofsky, it was terrific. They brought me through it without any pain, without any stress. Dr. Lavori is probably one of the best at what he does, because I never even needed so much as an adjustment. His temporaries, they do everything in that office. You don't have to go anywhere else. It was a seamless experience.
I love that. So since you've had the procedure, what was one thing that you couldn't do before that you're doing now that you enjoy?
Well, what I enjoy is the freedom of knowing that my mouth is in good shape. I eat, chew better. I digest my food better because I chew better. And also, cosmetically, I feel it looks great. It's changed my smile. It's changed my face.
What have your friends and family said with your new smile?
Oh, they all love it. They all love it. They laugh because I never smiled a whole lot.
Yeah.
That was one of my ways of covering up my teeth.
I know, having like the low smile line, not wanting to smile a lot. Like I said before, you got to keep smiling because that smile looks amazing.
Yeah.
And, there's a lot of people out here that, are thinking about it. They're scared. They're afraid of the investment. They're afraid of the surgery, maybe afraid of the dentist. It could be a lot of different reasons. What advice would you offer, somebody that's nervous about this or doesn't know if they want to do it?
Well, I think anybody would be nervous about it, but they have a young woman that works for them. Her name is Robin Green.
Yeah.
She's the one I met first. And she really puts everything down on paper. You know exactly what you're getting into financially. And Dr. Lavori and Dr. Konofsky bring you through the physical part of it. And as I said, through the entire experience, if I needed anything, it was all done right in that office. And when I walked in that office, I said to myself, this is where dentistry is going.
Yeah.
They have all the latest equipment. You don't have to go somewhere else to have something done. They bring you into the next room, and they have their own lab that makes temporaries. So anytime along the way, because it's a little bit of a long process, anytime along the way that something comes up, I can't think of one time that they didn't just fix it right away.
Right.
I didn't spend one day without teeth. I always had my temporaries.
Yeah.
And if something went wrong, they were always able to fix it and let me go on my way.
Yeah. I mean, I don't think a lot of people think about how important it is for a doctor to have a lab on site.
It's
to have
thing.
Yeah, a prosthodontist,
Nobody wants to be without their teeth.
Exactly. Yeah. So you didn't go without your teeth for any period of time. And now, you've got the finished product. And like I said, it looks beautiful. So
And
Dr. Valori and Dr. Konofsky, obviously, they do a lot of surgery, but they pride themselves on not having people feel like a number, right? Like they want to get to know you. Did you feel like that? Like what was your experience with them? And is there anything you want them to know?
Well, both those guys, and I've told them to their face that they're terrific.
Yeah.
Dr. Konofsky brings you through the starting work, and Dr. Lavori finishes it off. And they're an unbelievable team. And in my own life, I do things that are very mechanical. I'm a builder, general contractor, and watching them work, the precision and the patience to fit things and do things.
It's artistic, isn't it? Like it's
incredible. They're masters at what they do. There's no two ways about it.
They are, and it's no wondering. They love it. They love seeing these transformations. They love it when patients like you can get back to what life was like before when you didn't have any issues with your teeth. So I appreciate you, Bill, for taking the time and sharing your story, because your stories need to be heard so other people get their oral health back on track. So thank you, Bill, and keep smiling, right? Enjoy your day.
Thank you. And I would recommend this to anybody who has trouble with their teeth to see these guys. They're great.
I love it. You guys hear that? You guys make your consultation. Thank you so much, Bill. We'll talk to you soon.
You.
All right, man, this is such a great day because I have the dynamic duo of dental implant surgery from New York. We have Dr. Bruce Valori and Dr. Neil Karnofsky from ProHealth Dental Implant Center. Gentlemen, how are you today?
Excellent. We're great. We're happy to be here with you.
I'm so happy to be here with you guys. When I tell you, I had the most heartwarming experience hearing the transformations from your real patients. You guys are some dream makers out there. Let me tell you, everyone was just so happy, almost moved to tears about the work that you do. So Dr. Karnofsky, you are the periodontist in this dynamic duo. Tell me about what you do when you're getting somebody ready for this major dental implant surgery. What's the part that you play?
Well, we basically do everything together. We consult with the patients, we review everything with the patients, we treatment plan everything together. And then I sit down with the patient right before I do surgery. I review everything again. And I walk the patient through step by step so they understand everything that's going to happen that day and that there are no surprises.
Awesome. Yeah, because that's a big deal. Like, people want to know, how many days will I be without teeth? Will I be in pain? Like, how do you guys ease their fears? Like, Dr. Bruce, what do you tell them?
So information and knowledge is really the best way. Anxiety comes from the unknown. So as Dr. Karnofsky just, explained, we share information, we provide visual aids, we go through a presentation of what we do, how we do it, what the sequence is. We talk to the patients about what realistic expectations they should have going through the procedures. We talk about, what we can do to make it as comfortable as possible, both physically and emotionally, because sometimes these procedures, because they're so transforming, they can have a tremendous impact on somebody's outlook and how they look at themselves and their self-esteem. But to get there, the road can be a little bit bumpy, not to promise things that we can't deliver, but we're very confident that we have the ability, based on her experience, our knowledge, and the fact that we do have a very unique situation where literally together we work hand in hand with a patient to provide the highest level of care and experience that they can possibly have. And that's why we feel comfortable doing what we do and confident that we can do it on a routine basis.
And what I love so much about you guys' partnership and your duo is that, a patient basically is going to have the best of everything. Like, with a periodontist, you've got someone who is a master of gum disease and a master of being able to, make sure infections and things are cleared out. And then we also have the prosthodontist, which is the master of the finished product, to make sure that the smile looks amazing and that you're healthy. Have you ever gotten a case where it was just, you couldn't help them? Where, they hadn't been to the dentist in forever, or it was just too hard? Has that happened to you guys?
There are always options and alternative treatments. I mean, implants and full mouth implant restorations are not, the be all and end all. And we offer those options to patients. But again, I think from our education, our training, and our experience, we come from a position of the ability to offer what solutions may be for that patient that may not be ready to do the full arch implant rehabilitation. They may need to do things stepwise, or if their anatomy doesn't allow that to happen, at least in this day and age, but with the advances that are always occurring, maybe in years to come, they may be a better candidate. So we work within the parameters of what is appropriate for the patient, and we always offer alternative treatments because that's what's appropriate. And there's no pressure. I mean, patients make these decisions based on, as I said before, knowledge and evidence that we provide. And that's what we're here for. We're here to help people.
So it sounds like you guys have a great process down. We get people in, you get to know them, give them their options, make them feel comfortable. I'll throw this over to you, Dr. K. What do you think really makes you different? Because I do know there's other surgeons and people that do this procedure, but people flock to ProHealth Dental Implant Center. Why do you think that is? Why are you so different?
Well, I think you can attribute it to the team. Basically, Bruce and I have known each other for years since school. We work together very, very closely. We can basically complete each other's sentences. But there are many times during surgery where I call him in, or there's many times during the restorative process he calls me in. And I think it gives the patients a great degree of comfort to realize that we're both there for them the whole way through the procedure.
I love that. And I'll throw this question to either one of you guys, because there's lots of people out there who are on the fence, or they haven't been to the doctor in 10, 20 years. Or they're afraid of the dollar sign, that's attached to the procedure. What would you say to them, as both a clinician and just as one of us, to move forward and really take control over their oral health?
I can start with the fact is that, we first look at what the patient's health needs are. That's always paramount. And so if there's disease, whether it be decay or periodontal disease or infections, we identify, we review that with the patient, share their images, their radiographic images, intraoral images, and show them what's existing. And as I mentioned before, we also share our presentation with them so they have a good sense of what we can do for them. As far as the financial burden, there's so many ways of addressing this. We have a wonderful treatment coordinator that works as part of our team to really kind of shepherd the patient through the process. And she is very instrumental in finding ways to help people accomplish this goal, if in fact it's what they choose to do. And so that's where we start.
It could be a new patient, out there for the consultation. No, and kind of just to kind of bring it on home, people don't necessarily, they say they want dental implants, they want this procedure, but what matters is the person that's doing it, the surgeon, the team. And I want to throw this question out there. I'll throw this to you, Dr. K. Why should they pick you guys? Give me a few reasons so we can let them know.
Well, I think it's the education.
Yeah.
It's the training, and it's the communication amongst the team. And it's also the compassion that we have for the patient. This is a major undertaking for many people, both emotionally and in many other ways. And we want them to understand why this is the best way of accomplishing what they want for the long term. But as Dr. Villari said, as Bruce said, we give them all the options. But we just feel that just us working together as a team, integrated as we are, familiar with each other, right next door to each other, not next door in a different office, in a different operatory. I feel very fortunate to have Dr. Villari working with me side by side. It's a tremendous benefit for all.
Well, guys, you've heard it from the surgeons themselves. Dental implants change lives, as you've seen in some of the earlier people that we spoke to. And I've been witness to the work that these gentlemen have done and how much they truly, truly care. They're progressive with all the advanced technology. They work as a team to create your perfect smile. So Dr. Karnofsky, Dr. Villari, I thank you for your time and helping us get this message out there for people who need to see you, all right? So guys, set up your consultation at either Huntington or Lake Success, or who knows, they may even come to your house if you need to. No, I'm kidding. They do care. They care that much. They may stop by. But I appreciate you guys. Enjoy your day.